afternoon, everyone. Thank you for joining today's webinar on innovative outreach strategies for hepatitis B, lessons learned from Hep B United grantees. My name is Catherine Freeland, and I'm the Public Health Program Director at the Hepatitis B Foundation. We wanted to welcome you to today's session. Before we get started, I'd like to review a few housekeeping items and let you know how you can participate in today's webinar. Please note that all attendees are in listen-only mode and will be muted during all presentations. There's also a phone-in line option, which is viewed here, and the call-in numbers are listed. You have the ability to submit questions in writing during the presentation by typing them into the question box on your GoToWebinar control panel. We will be reviewing them as they come in, and we'll hold a question and answer session at the end of the presentations. And finally, today's webinar is being recorded. You'll receive an email with a link to view a recording of today's presentation after the webinar. To provide a little bit of background about Hep B United, we are a national coalition working to reduce the negative impact associated with hepatitis B in high-risk communities. We are co-chaired by the Hepatitis B Foundation and APCHO and comprised of over 35 organizations across 18 states with a mission dedicated to reducing the health disparities associated with hepatitis B by increasing screening, awareness, vaccination, and linkage to care in high-risk communities. Today, we have featured coalition partners represented on the webinar. All are mini grant recipients from Hep B United mini grant program. Our speakers today are Kristen Milanarczyk she is a public health associate from Colorado Children's Immunization Coalition. We also have Paul Lee. He's the project coordinator and grant specialist and public health research center at Korean Community Services at Metropolitan New York, KCS. We also have Hong Liu. She's the executive director of the Midwest Asian Health Association. And she will also be joined by Mohammed Islam, the executive director of the Community Welfare Services of Michigan. We want to welcome all speakers today. So we'll get started by Colorado Children's Immunization Services. And at this time, I would like to turn it over to Kristen and Stephanie, who will be providing an overview of the coalition and their work.
Hi, this is Stephanie Wasserman. I'm the executive director of actually our newly renamed organization as of January 1st. We rebranded as Immunize Colorado to represent our support of immunizations across the lifespan. Can I have the next slide, please? So Immunize Colorado was founded in 1991, and we are the only statewide nonprofit in Colorado. Oops, can you go back one? Oh, yeah, that serves to protect Colorado families, schools, and communities from vaccine-preventable disease. Next slide, please. So again, we were founded in 1991, and our core program areas are coalition building, community outreach and awareness, healthcare provider education, data translation and action, and partnering to host free and low-cost immunization clinics. And then we advance public policy. And we are unique among many of the coalitions in that we do not accept any funding from vaccine manufacturers and distributors. Obviously, we partner with them very closely, but all our income is from grants, contracts, and donations. Next slide, please. Here again is a list of the 6 different program areas that we are focused on as a statewide coalition. And today, Kristen will really be focusing on our coalition building program and our community outreach and awareness, and our provider education. Next slide, please. And now I'm going to turn it over to Kristen.
Thank you, Stephanie. So this is Kristen. I'm going to go ahead and give a brief overview of what I'm going to cover today. I'll start by reviewing what our mini grant goals and objectives were, and afterwards discuss the success, challenges, and lessons learned over the first year of the grant. Next slide. So just to provide some context on hepatitis B rates in Colorado, it's estimated that over 17,000 individuals are living with chronic unresolved hepatitis B, and a disproportionate number of Asian American, Pacific Islanders, and Native Hawaiians are affected by the disease. A 2018 viral hepatitis B in Colorado report put out by the State Health Department indicated that AA and HPI communities had the highest rates of chronic hepatitis B each year between 2009 and 2018. The map on this slide shows the geographic distribution of reported cases, with the highest number of cases in the Denver metro area, including the Arapahoe, Denver, and Adams counties, and this is the main area where we focused our interventions. Next slide, please. So the overall focus of our mini grant was to educate providers and communities in Colorado to reduce hepatitis B disparities in Asian American, Native Hawaiian, and Pacific Islander communities. To do this, we developed a three-pronged approach, with the first goal focusing on increasing knowledge of hepatitis B prevention, testing, and linkages to care among Colorado's AA and NHPI communities. And we leveraged our existing coalition to engage with new partners and work with existing ones to increase awareness. The second goal was focused on educating Colorado healthcare providers on the latest guidelines and recommendations related to hepatitis B screening, vaccination, and treatment. And then our third objective focused on working to increase the number of patients receiving the Hep B vaccine at our Shots for Tots and Teens immunization clinics, which provide free or low-cost vaccines for both children and adults who are uninsured or have Medicaid or CHIP. We also focused on providing Hep B fact sheets in multiple languages at the clinics for patients to share with their families and communities. Next slide. And to give a little bit more detail on the activities that were focused on our first goal of coalition building, we met with several organizations to develop partnerships to provide Hep B education at awareness building events. And an important partnership we established was with the local Asian Pacific Development Center. We also attended meetings of the state's viral hepatitis task force to share information and resources. So in total, we hosted 6 hepatitis B education and awareness building events in the community. 3 events focused on educating community health workers and navigators and providing them with Hep B materials and resources to distribute to their patients. And we gave out hundreds of the CDC's No Hepatitis B campaign resources in multiple languages, including Chinese, Korean, Vietnamese, and English. We also hosted several community education events, including presentations to the Vietnamese, Cantonese, and Mandarin-speaking elder wellness groups at the Asian Pacific Development Center. And these presentations focused on the importance of hepatitis B awareness, screening, and linkages to care. Each presentation had PowerPoint slides with translated infographics, and the program coordinator with APDC at each event translated the presentation and facilitated the follow-up group discussion. We played a hepatitis B Just B storytelling video in each group's language, and at each event, this video was followed by an extensive group discussion. We also distributed more hepatitis B CDC campaign materials in the appropriate language. Next slide. And I just want to highlight these resources. They were an integral success of our project, and I highly recommend checking out these resources. I have them linked within this slide. The CDC No Hepatitis B campaign is a multilingual campaign with materials in multiple languages, which we incorporated a number of these resources, including the fact sheets, videos, and infographics into all of our community outreach strategies. And I also want to highlight the Hepatitis B Foundation Just B storytelling videos that are also available in multiple languages. We shared videos in Cantonese, Mandarin, and Vietnamese at the elder wellness groups. And in all of the groups, the Just B videos in particular fostered very deep and open discussions on hepatitis B. And I also highly recommend the companion discussion guide provided by the Hep B Foundation. This really helped to inform the structure and nature of our discussions. And lastly, the Asian Pacific Development Center was integral as well. The program coordinators at each event were native speakers of the language spoken by each group and translated the presentations and led the group discussion. Next slide. So to address our second goal, we hosted 2 provider education events, which were hosted at the Conference and Education Center at Children's Hospital, Colorado. We also provided a remote webinar option. In the spring, we hosted Dr. Janine Young, who is the medical director of Denver Health Refugee Health Center, and she presented on hepatitis B in immigrant populations and the need for improved testing, vaccination, and ongoing care. We had 94 attendees from 27 different states and the District of Columbia, and the audience included physicians, nurses, public health professionals, and epidemiologists. In the fall, we hosted a physician from Denver Health who presented on chronic hepatitis B management and prevention of perinatal transmission. We had 31 attendees for that event, and that event was, again, attended by a similar audience, physicians, nurses, and public health professionals. And we also recorded all of the events and archived them on our website, and I have a link to that on this slide as well. Next slide, please. And then finally, to address our third grant objective, we coordinated monthly free walk-in immunization clinics, which are called the Shots for Tots and Teens clinics, which are a partnership between different local public health departments, municipal fire, EMT departments, and Rotary clubs. In 2019, we partnered to host clinics to reach low-income, uninsured, or publicly insured AA and NHPI patients, and added an additional clinic location to help serve the needs of the community. Hep B vaccines are available at all the clinics, and to capture the number of patients immunized, we improved data collection at the clinics to start including documentation of antigen-specific doses for hepatitis B. In 2019, we administered over 100 Hep B vaccines in particular. We also provided 750 handouts at the clinics, which provided information on linkages to care and CDC No Hepatitis B fact sheets in multiple languages. Next slide. And this is just a brief summary of some of the highlights of our first year working on this grant. We distributed over 1,000 Hep B educational resources at the clinics and different educational events in multiple languages. We also provided over 100 Hep B vaccine, hosted 8 Hep B educational and awareness events to educate 236 healthcare providers and community members. To further reach the community, we had a social media marketing campaign to promote awareness of hepatitis B, especially during the month of May, which is Hepatitis Awareness Month. And we disseminated content on our social media platforms, including Facebook, Twitter, and our website, with a total of over 1,500 impressions. In addition, we also shared the Hepatitis B Foundation's Just B storytelling videos. Next slide. And to wrap up, I'll briefly touch on several challenges we encountered in our first year of the grant. One of the biggest challenges was related to scheduling the provider education events. The physicians that we work with have set clinic hours during business hours. So it was a little tricky to coordinate schedules, but in the end, we were able to coordinate 2 successful events that reached over 100 healthcare providers. We also worked to recruit a Just B storyteller, but were not able to identify one. We spoke with many people with personal stories, especially at our elder wellness group presentations, but we still continue to build relationships and trust with the community. As we make more connections in the community and reach larger audiences with our events, we're hoping to identify a storyteller soon in the future, maybe this grant cycle. Overall, the biggest key takeaways we have after working on the first year of the grant include the importance of partnering with trusted organizations already working within the community and leveraging existing partnerships to reach healthcare providers working with the AA and HPI population. And again, using the language resources available from the CDC's No Hepatitis B campaign and the Hepatitis B Foundation were essential in our work. So that is it. Thank you. If you have any questions, we will have Q&A at the end, and then you can also contact us on our emails, which are provided on this slide.
Thank you so much, Stephanie and Kristen. That's great. At this time, I'd like to turn it over to Paul from KCS. Paul, if you want to take it away.
Hi, everyone. My name is Paul Lee, Project Coordinator and Grant Specialist at Korean Community Services, KCS, and at the Public Health and Research Center. Next slide, please. So just a little background on KCS. We were founded in 1973, and we are now the oldest, and I believe the largest 501c3 nonprofit assisting Korean Americans, but basically any other immigrant communities and other community members of need at this time. And so currently we offer a lot of services, including the Public Health Research Center, where our Hep B work happens. We have workforce development, 2 senior centers, an adult daycare, and also a mental health clinic. And we provide a lot of these services across the NYC metropolitan area, including Long Island, and now we're doing more activities in Bergen County, New Jersey. And for our programs, a lot of our aim and focus is on disease prevention, education, access to healthcare, healthy living, and advocacy. Next slide, please. So the core of our Hep B program is actually facilitated in part through the Hep B United mini grant, which we've received for the past 2 or 3 years, I believe now. But our actual activities are supported largely through the NYC Check Hep B patient navigation program. It was founded in 2014 by the New York City Department of Health, and it was designed to help CBOs like KCS identify patients, facilitate logistic care, and provide culturally competent patient navigation services. Next point. So as of 2018, the Department of Health estimates that there are approximately 240,000 individuals with CHB in New York City at this time, with about 6,075 newly reported cases in 2018 alone. This is actually a significant increase from the previous year's prevalence estimates, because they've updated their surveillance techniques and drawn more of their statistics from a wide number of different providers. And so that's where the 240,000 figure has come from. KCS joined the coalition in 2014, and since then we've screened about 3,000 community members and have enrolled about 180 patients into our program. If you click next, it'll give you a little bit of and so in the past year we've enrolled about 50 patients. So right now we're managing and assisting about 50 patients, but we have about 180 patients in our database. Every so often, a couple of people come back to us and receive care again. Next slide. So as part of the Hep B United mini grant, and this really supported our work, as we do a lot of outreach at FBOs, specifically churches. One of the main reasons being about 71% of Koreans attend some kind of FBO, and which predominantly are Christian churches. Furthermore, many of our screening activities are hosted at FBOs, and main reason being it's just a great place to get a large number of people together who are going to be there already. And for the past several years, whether it's Hep B or a lot of our other programs, we've conducted a lot of screening and outreach at FBOs. Despite that, we still face a lot of obstacles related to community stigma and misconceptions around disease, and that's one of the things I'm going to talk about today with our toolkit. But it's it continues to be a prevalent issue in trying to reach people who are in need. And that being said, so we've kind of taken this top-down approach where we're educating church leaders, whether it's head pastors or junior pastors or just other lay members of the church, to help dispel some of these myths and stigmas, and to kind of like approach and motivate them to conduct screenings through a spiritual and religious lens. We've also noticed that many leaders, especially younger leaders, are more health and wellness focused. So when we talk to them about Hep B or the prevalence in the Korean community, a lot of people, there's a pretty positive reception in terms of wanting to actually do something. And so with that in mind, next slide please. So last year, as part of our the Hep B United mini grant, we developed this toolkit, and it's designed to, one, educate church leaders through kind of like a spiritual lens about the prevalence of Hep B in the community, some of the issues with stigma and ostracization people kind of face, and that we've seen through our patients, and kind of and to link them to resources provided by KCS or other organizations to conduct screenings and link patients to care. So this is just 3 pages. It's about a 17 to 18 page booklet, but each section has a different topic. As you can see, there's also resources like the 3rd page that kind of has like statistics, and they can put these out and pass them around their church or other community members. And in the middle, it's in Korean, but it basically talks about what church leaders can do about Hep B in their congregations, and highlight the fact that there may be people in their congregations who are, unwilling to get checked, or most people are unaware, but are maybe unwilling, and to kind of motivate those people to, one, accept other congregant members who, may or may not be suffering from hepatitis B, and secondly, to undergo screening, because that's also another challenge that we've encountered when we conduct screenings, is people, even if it's available, people don't necessarily seek it out out of fear of being seen getting, a blood test. Next slide, please. And so as part of the toolkit, we also developed a faith-based coalition that's focused on just eliminating hepatitis B. We were able to gather about 8 head pastors from different Korean United Methodist Church congregations in New York City. And we were able to meet them and gather them by joining on their annual fundraising walkathon event. And this is something that we've had some great success with, because gathering 8 pastors together at one time has been extremely, meeting with one pastor is difficult as already. But this is a really great opportunity for us to just bring 8 of them together and their congregations to really just pass out the toolkit and educate them about hepatitis B. If you click next, it'll have some pictures, I think. Yep, and that's the pastors and myself in the corner after giving them a brief rundown and giving them the toolkit. And then the next picture, I think, is just all the congregants and members there. The next slide. And so another facet of our Hep B program is this annual liver health forum that we hold every October. And so this past year was our 3rd, and we're intending to do another liver health forum this year. But we invite clinicians and specialists to speak about their clinical experiences, and to also, take questions from community members about hepatitis B or liver health in general. And we've had some really great successes with this too. We consistently bring about anywhere from 100 to 200 people for every event. There's a small dinner or whatever, and they really get to engage with clinicians in the area. And we've had representatives from the Department of Health and other specialists in Queens and across New York City come and speak, and it's been really great. Next slide. Also, this past year, we've launched a radio PSA, and this has actually been a really great opportunity, and we've seen some great successes delivering this PSA. So we've created about 2 or 3 different types, one focusing on new patients. We have another one on people who know that they have hepatitis B but lack access to treatment. And then a 3rd one targeting just general community members to reach out to KCS if they need patient navigation services. So we've been partnering with KAN 1660 and they have about 3,000 plus listeners across the tri-state area. And in the past few months, we've been getting a lot more calls from people outside of New York City who are seeking support. So this next slide, hopefully it works, but just a really short clip of one of the PSAs that we broadcast this past month. I mean, if it doesn't work, it's totally okay. There's the translation that's been included. It's not 100% accurate because my Korean proficiency isn't as great as I thought. But that being said, it pretty much covers the range of what is in the PSA. It's only about a minute long, but it really is trying to highlight one, the difficulty that many of our patients face in getting care. I think Korean Americans out of all of Asian American demographics in New York City are the highest uninsured. So that's a massive barrier to receiving treatment. There's also extremely high prevalence in the Korean community. And so we wanted to highlight the availability of our patient navigation program and have people reach out to us, while also reminding people to undergo regular checkups and screenings for those who may have access to care. Next slide, please. Thanks. So for the future, and since we've created the New York Hep B faith-based coalition, we've added 2 more church leaders and congregations, and I think we're in discussion with a third congregation. So we've been having some great success in that regard. We've also opened up a new office in Bergen County, New Jersey, which incidentally has an even higher Korean American population just in that county than all of New York City. So it was it's a great opportunity for us to help the community members there. We've also working for this year's activities with the Hep B United mini grant. We're trying to create a faith-based coalition in New Jersey, and we've recruited about 2 churches so far. So we're aiming for 5 to start it off, and then hopefully it'll continue to expand like the one in New York. We're also seeking to expand to other belief systems, including Buddhist temples. Statistically, there's a lot less Buddhist temples in the area, but there's a large number of Koreans who attend those places of worship as well. So we really want to expand our range in that site. And just to highlight, one of the greatest challenges we're facing at the current moment is there's some significant funding cuts at the state and the city level, specifically to what's called Article 6 matching funds for CBOs doing health programs. And so KCS is working pretty hard with the rest of the Hep-free NYC members to help the Department of Health come up with a viral elimination plan by collecting feedback and comments from the community, and also meeting with city council members and at state representatives to try and allocate some secured funding to support the Check Hep B program into the future. But yeah, that's about it. You'll find at the last slide some resources that you can go to. The second link is for the toolkit. It's both in English and Korean. Unfortunately, the Korean one I noticed today had some issues, so I will be re-uploading that hopefully by the end of this week. But there's some other information there, as well as the report with the new updated prevalence figures. And if any of you are interested in partnering with KCS for any future opportunities, just feel free to contact us, and we'd love to have a discussion with you. Thank you.
Thank you so much, Paul. That was really informative. All right, at this time, I'd like to turn it over to Dr. Liu and Mohammed Islam as well to share about their experience with the mini grant program. So Dr. Liu, I'll turn it over to you.
Hi, good afternoon. This is Hong Liu, Executive Director of the Midwest Asian Health Association. Mohammed Islam, Executive Director of the Community Welfare Services of Metro Detroit, is joining me to answer any questions. So a little background about this program. MAHA has many years of hepatitis B program in Chicago, and through 5 years of working experience with the Bangladesh community in Michigan, and we realized there is no pro-hepatitis B program, no resources in the Bangladesh community in Michigan. So I apply for the mini grant from the Hep B United to help with this isolated small community in Michigan to start the Hepatitis B initiative. So we are very appreciative of Hepatitis B United with this opportunity. So the program, the mini grant program, targets the medically underserved and hard to reach Bangladesh community in 3 cities in Michigan, with a total population size of 31,600. This program, this community has never been involved in any national or local efforts for hepatitis B awareness and prevention. So the purpose of this mini grant is to identify and address specific local barriers to hepatitis B awareness, education, and help to improve their capacity for future hepatitis B intervention. Next one, please. So some demographic information about this community. Most people working in a factory to produce plastic parts for cars, and people working in restaurants, and working as cashiers at the grocery stores in the local community. So the average annual household income of the population in Warren is $22,000 per year, and in Detroit and the other city is about $12,000. So it's a low-income community. The education level is very low as well, most without high school diploma or equivalent. The employment rate among those populations in these cities is 5.37, which is higher than the national unemployment rate. Next one. So because little is known about this community, especially about the population's knowledge and the needs for hepatitis B. So we started this program with the hepatitis B survey. So this is the first ever survey in the Bangladesh community in Michigan. And the purpose is to understand the knowledge level and the awareness about hepatitis B among the population. 206 people participated in the survey for the first time about hepatitis B. Next one, please. So this is the poster presentation that Saiful Islam presented at last year's Hepatitis B Summit, and he did a great job with a lot of information from the survey. So I'm not going to go through all the detailed information and findings, but please pay attention to just the key findings. If I can bring your attention to the 3 pie charts at the bottom with the red and the blue color. So when we ask people what is hepatitis B, 66% do not know, and only 6%, I'm sorry, go back please, 6% know what is hepatitis B. And when we ask people about do you know how hepatitis B spreads, only 11% people say they know. 83% do not know how hepatitis B is spreading. And when we ask people, how do you know how to protect yourself from hepatitis B, 66% of people do not know how to protect from infection. So this is alarming data finding from this population that there is a huge need for awareness and education. Next one. So based on the, of course, the needs assessment and the survey, so we developed a strategic plan. Of course, we have to start from outreach and education, increase awareness, which we are using the mini grant to launch the hepatitis B initiative in this community. And moving forward, we hopefully to raise more funds and get more resources for hepatitis B screening and immunization. We are not there yet because there is a huge shortage of resources and infrastructure. We are trying to build and improve the capacity in the community. Next one. So with this mini grant, we've done a lot. We conducted, like I presented, conducted the first successful community survey project on hepatitis B. And this is the first time we formed a hepatitis B advisory board consisting of 10 community members from the community. And one representative, which is Saiful Islam, he represents the Bangladesh community to join the Hepatitis B Hep B United coalition. And then there was no representative in the past, but since last year, he is the representative and getting a lot of information and education information from the coalition. And the MAHA assisted with developing hepatitis B presentation and flyers and other information intakes. They all translated into Bangla. We also provided on-site training on hepatitis B screening, immunization, and follow-up care to the coalition members from that community. I'm going to talk more about that later. The community started a local campaign through distribution of hepatitis B information, flyers in the religious institutions, local grocery stores, and other events. The community also used social media such as Facebook and Twitter to educate children. Even if the first generation with low literacy, they don't use online and social media like Facebook and Twitter, but their kids educated here, they have access, they know how to use those social media to help their parents, grandparents to understand the issue. The community provided community outreach education using different strategies and locations. We are talking more about that, what are the strategies most useful. As a result of the education and wellness, the community members have shown an interest in education, screening, and vaccination for Hep B. Next slide. Next slide. Oh, go back. Yeah, this is the advisory board meeting consisting of more than 10 community members and all are community members from the Bangladesh community. Next one. So this is the on-site training. 2 coalition members from Michigan traveled to my site on the hepatitis B screening date. So I walked through them from intake to screening to how to interpret the lab reports, how to inform people of their lab results, and where to get resources for immunization. And we have a free hepatitis B clinic by a volunteer hepatologist. So I try to mentor them with all the information from its education intake, screening, immunization, and patient care. They brought a lot of information back to their community, and we are trying to help them to establish the infrastructure for starting hepatitis B screening there. Next one. So the best multi-approach outreach strategies, including the following. Saiful, do you want to present this slide?
Yes, actually, our target mainly is to outreach the people for educating them about the hepatitis B as the gloomy picture we found from the survey. So our strategy started from social media, means we have got within the community telephone communication each time. This is group communication. About 80 to 85 people has got it. Once I give the information, all of them get it. So 5 means 80, 400 people get the information. So this is the way we do it, social media. And event, actually I made the event in 2 groups. One is group discussion, another is a big event in a local hall. So group discussion, I do it myself. I call the people I invite the people in my office twice a month in a group of 10 or 12 people. And I try to educate them on what is hepatitis B, how to protect it, how it spread, and all these things. And in the event in a local hall, about 100 people they get together, and one expert I requested in the local primary care provider. They They give speech and educate these people. And actually, religious institute, every day 5 times people, about 50 to 100 people come and perform their prayer. But particularly on the Friday, 500 to 1,000 people come to the East mosque, and the leader imam sometimes announce about these problems in not only the hepatitis B, colorectal cancer, and other things. And there are also Muslim festival. It depends on the lunar calendar, so we call it Eid. So there are 2 in 1 year. About 3,000 to 5,000 people, they get together in a congregation of in an open field. If the weather is not good, then in the mosque or the hall, and they perform prayer, and they actually spread the news, and they talk among themselves so that they can understand the situation here about this all these diseases and public health. Yes.
Yeah, thank you. So based on the culture of this community, one of the best strategies we can tell is through the religious events, the Muslim festivals and the religious institutes, so which this is very unique for this population, and we try to utilize those religious events to provide education. Next one. So challenges and the barriers to health information and care. Of course, always there's a severe shortage of bilingual primary care doctors who are the reliable sources of health information and the care for this community. There's a low health literacy and a lack of knowledge regarding patient rights and the responsibilities. We say patient rights and responsibilities is that we realize that there is a actually some of the providers, they don't have enough knowledge about the hepatitis B issues among the Asian population. So we try to empower patients to understand that they can request testing for hepatitis B. They can educate providers rather than just obedient and then follow providers' order. They can initiate a conversation and then request for testing or immunization. So that's something we found through educating patients and the providers, that not every provider knows about the importance of screening and testing the high-risk population. And of course, people are reluctant to do this because of the language and culture barriers to healthcare and the compliance. Lack of knowledge, I mentioned already, lack of knowledge among the healthcare providers regarding hepatitis B testing and the risk. It's always the case with a lot of states and cities that there are few public hospitals in the areas serving the needs of the population who don't have insurance. Lack of infrastructure for hepatitis B screening, immunization, and follow-up care. And the mini grant is the first ever grant to help this organization, help this community. So there is a lot of work we have to do to build infrastructure and move forward with hepatitis B screening and immunization. This is, like I said, this is the first grant, so there is a lack of funding resources to provide the free hepatitis B screening immunization. Next one, please. So recommendations for future efforts, of course, continue to provide the community education and awareness in a culturally and a linguistically competent manner, build infrastructure for hepatitis B screening, immunization, and resources for follow-up care, educate providers about hepatitis B screening among the high-risk populations, empower the patients to talk to their providers and initiate a request for hepatitis B testing, increase efforts to partner and participate in the local and national advocacy activities, and the last, not least, improve fundraising efforts to sustain the program. So this is what we have so far with this project. Thank you so much.
Thank you so much, Dr. Liu and Mohammed, for sharing that insightful information. At this time, I would like to begin our question and answer session. We do have some questions that have come in, but I wanted to remind you all, if you do have a question, please submit them in the question box in the chat or the chat box, and please do so at this time. We do have a few questions that have come in. I believe the first one is for Kristen and Immunize Colorado. If you wouldn't mind sharing, we've had a couple of questions asked about the providers and how you were able to recruit that many providers to attend these education sessions. Do you have any strategies or suggestions for the audience on how to recruit providers and get them to come to these educational opportunities?
Sure. So we have a pretty big listserv that we have in our coalition, and then we would also contact different organizations that work within the communities and ask them if they could share it on their listserv. In fact, Hep B United did share a blurb on marketing the event. So yeah, I found that just reaching out to people that are running listservs at different organizations with your intended audience was really helpful for us.
And do you have any suggestions in terms of timing? I know you said that there was an issue with scheduling. Do you have any advice or recommendations on how to coordinate that with providers?
Sure. I think just planning well in advance, like months in advance, just because a lot of the providers have those clinic hours only during business hours, which overlaps with when we would have the event. So just getting it on their schedule, anywhere between 3 to 6 months in advance.
Great, thank you. The next question I have is for Paul. Do you have any suggestions to coalition partners or community partners on how to get connected or get buy-in from faith-based community and faith-based leaders?
Yeah, I would love to talk about that. So for us, it's really about just persistent contacting. A lot of the churches we do work with, or a lot of the faith-based organizations we have worked with in the past, so there is an existing connection. But especially for the new coalitions that we're building, it's really just been about finding. It's not necessarily contacting the pastor, which isn't always, that information is not always available, but getting in touch with someone like their secretary or one of the junior pastors or someone a little bit lower down on the totem pole has been a really great way to kind of like get into the church. That's been kind of the main strategy we've been taking. There's also a lot of word of mouth. Once we reach out to one church and do some kind of screening or outreach activity there, we have seen other churches contact us saying, oh, we heard that you did an event at this church. Would you guys want to come and do that for us too? And so that's been it's just about really being persistent with your contact, because what we've noticed too is a lot of the pastors are just super overwhelmed with their regular duties, and unless it's really being pushed onto their plate and they're being actively reached out to, they probably won't respond. So it would just be, I think persistence is really the key to making those inroads.
Thank you. And a follow-up question as well. You mentioned using radio and that having a really large impact in the community. I think some of our coalition partners have really struggled with trying to get media buy-in as well. Do you have any suggestions or strategies that you would care to share with us to really be able to reach out to the radio communities? How did you guys do it? And do you have any suggestions on how to do that successfully?
Well, for us, and unfortunately this part isn't so much in my scope of work, but from what I know, it's really coming up, approaching the media distributors and really having things prepared. We've in the past, I know we've had like multiple scripts that we send along with request to, broadcast the PSA. And it hasn't always been successful, but I think it definitely helps to have an idea of what you want to broadcast or, distribute, whether it's newspaper or radio, beforehand. And I think that really gives better leverage in the discussion because it's less work for the distributors. And ultimately they end up, editing down a lot of the content and making it more, more accessible. But at the same time, I'd say, I'm not sure too much in terms of like convincing them, but I think that's kind of where I've seen the greatest success is when we come up with our own PSA or format, and even having a rough recording or something to present to them, which they have been more receptive to than just reaching out of the blue and asking and proposing something like that. Having something prepared beforehand has been really beneficial, I think.
Great, thank you. This next question is for Dr. Liu and Mohammed. You both mentioned that this is the first really outreach for hepatitis B for the Bangladeshi community. Do you have any suggestions for others across the U.S. who might be interested in connecting with the Bangladeshi community, and how, best practice might we be able to think about doing that?
Actually, our people does not know much about this. That is why we are going to them directly, and we are requesting that rather we are educating them to go to the PCP and tell them for their blood test and hepatitis B screening. So even in our some meetings, congregation, we invited the local primary care provider so that they can understand the gravity of the situation that the people are doing it. So actually what we need, that is screening is very much important, and that should be free. So if we get from other partners for screening help, that would be very much effective for our community.
We would be happy to expand the program to other Bangladesh communities nationwide. So if any people are interested in learning from our initiative, and we will be happy to help them to develop this initiative in other parts of the country.
Great, thank you. And you mentioned as well using social media as an effective way to reach out to the Bangladeshi community. Which platform did you find most effective, and what strategies did you use to reach the community directly?
Actually, for reaching the community, it is best way to distribute flyers in the local masjid, means institution that people go for performing their prayers. That is the best place where we can announce, and also we can distribute the flyers. Beside, we also we have got the group of telephone groups. If I put one, then it, as I told you before, that 80 people at a time get the information what I want to say about this. So, but instead of all things, group discussion is the best way to reach the people and educate the people.
Thank you. So in person is preferred then with this community, and using flyers and handouts to distribute health information. Great.
Yes, yes.
Thank you, thank you. Let's see. The next question I have is more general, and it looks like it may be directed to Kristen, but I imagine others can answer. How did you overcome challenges related to healthcare providers, especially when you need to go back to the community you previously screened and have not been very successful in connecting to care? So I'll open that up to anybody. I know, Kristen, you guys have worked with providers as well as Dr. Liu in thinking about the Bangladeshi community. Do you guys have any thoughts on overcoming challenges related to healthcare providers and how to get their buy-in?
Hi, this is Hong Liu from Chicago. our experience is that we establish a community-based free hepatitis B clinic. We have a volunteer hepatologist that come to our monthly hepatitis B clinic to take care of those people we identified as the carriers. I think many people have challenges to go through the institutional system to seek special care for hepatitis B, which has been always barriers for, especially for immigrants and refugees who have a limited English speaking ability. So we decided to establish a community-based clinic right in our center at the community-based center with access to the local people. So after we identify them as the carrier, we call them, make appointment to come to our center. We are very, very lucky and fortunate to have a volunteer hepatologist who donate his time to come here once a month. And then we follow up with screening, medication. We apply for patient assistance program for medication for people without health insurance. And then we also collaborate with the Chicago Department of Public Health for immunization. So we do comprehensive care for this population who otherwise will not go to the mainstream hospitals or clinics for follow-up care. So that's our model. It's a community-based clinic with a volunteer hepatologist and other resources to build infrastructure to take care of them.
Thank you. And this is just another follow-up question. Have you found any unique cultural barriers to increasing awareness around hepatitis B education within the Bangladesh community?
Yes, actually, translation of the tools, whatever we get from different sources, and let them educate on the hepatitis B elaborately. That is the best way to educate them.
For my experience, and this is only again in the Chinese community, if we just say come here for hepatitis B screening, we may not, just for hepatitis B, we may not get a huge participation. But we use other health screening education like cholesterol, hypertension, diabetes, those topics together with hepatitis B, we get a bigger participation. So we do not just say Hep B because some people may feel, especially people working in a restaurant, that they feel that if they come to these type of events, people suspect them may have hepatitis B, and if their boss knows in the restaurant, they may lose their job. We did have a restaurant workers had that experience. So we do not just say Hep B, we say health and in general. And when we provide screening, we provide screening not just for Hep B, but for other diabetes screening, cholesterol screening. So people feel more comfortable come to health fair or come to a screening program like that, rather than Hep B or HIV, things like that, to reduce people's stigma in the field.
I also just wanted to build off what Dr. Liu just said. That too has been a really great way to reach people and boost screening numbers is by offering kind of like a range of different screenings. Because just to do Hep B, although we do get consistent numbers in that way, I think there's definitely a significant increase in the amount of people who get screened if there's offering, say, it's a diabetes screening or hypertension or some of the other programs that we offer alongside it. And it's, I think people have been way more receptive and less scared to undergo screening if there are other options available too.
Okay. Thank you. Well, keeping in mind the time, I know it's 4:01. I wanted to end there, and I wanted to also echo if you have follow-up questions, there's some email addresses and information listed here on the links on this final slide. If you have follow-up questions, please don't hesitate to reach out and we can direct your questions and connect you to webinar speakers from today's session. I wanted to thank our panelists for this rich discussion and the information they were able to share on their innovative strategies to hepatitis B testing and education and awareness outreach strategies. If we were unable to get to your specific questions, please do not hesitate to reach out to us at connect@hepbunited.org. I would like to thank our speakers. Thank you all so much for participating and providing this rich information to our participants. And I wanted to also remind all of you on the listening and the audience to look out for a survey from the Hepatitis B Foundation as you exit the webinar. I believe you'll also get an email as well. If you don't mind filling that out and sharing some feedback with us so we can improve upon these webinars and provide the best types of webinars for your practice in public health. Thank you all so much for joining us today. We really appreciate your time and hope you have a great rest of the day.
Thank you all.